This push comes at a time when most kids are still not allowed back in classrooms in large numbers, and teachers caution against reopening until everyone is vaccinated. A Stanford doctor has figured out a way to detect COVID-19 using an ultrasound. Here to tell us about the machine that fits in his pocket is Dr. Andre Kumar. Thank you so much for joining me, Dr. Kumar.
Thank you. Happy to be here.
Well, it almost looks like, from the pictures that I've seen, it almost looks like a handheld thermometer, but I'm going to assume this ultrasound does more than just take your temperature, right?
Absolutely. Ultrasound has been in use for several decades, and lately the technology has become far more portable that doctors at the bedside can evaluate patients. Right now, we have technology such as these probes that can fit in your pocket, and it can connect to your smartphone. At Stanford, one of the things we are doing is evaluating our COVID-19 patient population with point-of-care ultrasound. It has several potential benefits, including a real-time assessment of the patient and how their heart and lungs are doing.
So right now, taking a COVID test, a little bit uncomfortable. You got to stick it up your nose. It takes a couple of days to get the results. Does this actually detect COVID accurately like a test would?
Absolutely. It does detect COVID quite accurately. And more than just detect COVID, we can actually see in real time what is happening to the heart and lungs with COVID.
So it will show you if there's like fluid buildup or something like that in someone's lungs.
Yes, absolutely. And the other important aspect of this ultrasound is it has some predictive utility. We are now starting to study point-of-care ultrasound in our COVID population, and we have very good data to suggest that certain ultrasound findings can predict how these patients are going to do 30 days out from when their scan was. So now I can predict if a patient is coming in, if they're going to go to the ICU, if they're going to require a ventilator, and in some cases, unfortunately, pass away.
So can you talk to me just a little bit about this ultrasound? Was it created just for this, or how had it been used prior to now the COVID function?
This particular ultrasound is part of a growing trend in healthcare of making diagnostics available at the bedside for clinicians such as myself at the front line of the COVID-19 pandemic. We've been partnering with an ultrasound company called Wave Health at Stanford to conduct this study. There are a variety of handheld ultrasounds that are now available. The technology has made these devices quite affordable for doctors to use in their day-to-day practice. And it comes with several benefits over traditional X-ray or CT scan. The most important being it doesn't expose the patient to ionizing radiation or harmful radiation. In addition to that, it also provides an accurate and real-time assessment as opposed to an X-ray or CT where you have to wait for a radiologist or a report to come back to you.
Right, and usually if you're doing any of those other types of scans, you have to move the patient from the room somewhere else. Obviously with COVID, you have COVID isolation units and that sort of thing. You don't necessarily want to be moving those patients, so this has to really be kind of a game changer. You said you guys are already using this at Stanford?
Absolutely. We are now using it for our COVID-19 patient population. We are also doing this in a joint effort with UCSF as well as part of this study. And your point about the use of this to protect our PPE supply is so important. When you think about the current clinical care, a radiologist and a technician has to come into the room, don on their own PPE. The machine itself has to be decontaminated, which can result in significant delays in care. And then if you think about resource limited settings where PPE is not in abundance of supply, or the only machine that you have is limited in capacity or maybe broken, point-of-care ultrasound represents a cheap and effective technology that can really transform how we're caring for our COVID-19 patients.
And so how have you seen, have you used this and been able to detect something that then quickly you were able to remedy what was going on with your patient?
Yes, we use point-of-care ultrasound, as I mentioned, for a real-time assessment of our patients. If you think about ultrasound and how it's been used for the last 20 or 30 years, its use has really risen in emergency medicine, where we have trauma patients coming in and we need to quickly identify potential issues that are happening with them. we've now transported a lot of that technology to these handheld devices that we can use in a hospital setting, in a hospital ward, to quickly identify issues related to the heart and lungs in our COVID population. I would also say that the PCR tests that we do, while great, there are false negatives with it. And I have frequently scanned several patients with these devices. And based off of what I see on the device, I actually resend the test and the PCR comes back positive. So it can be quite sensitive at picking up COVID-19.
Very interesting. So, I mean, going forward, obviously, we are at the point now where more and more people are starting to get vaccinated. We obviously don't know how long the vaccine is going to protect us. So when it comes to how this will play a role in the future, what do you see the benefits being of people being able to use this post, this extreme surge and situation that we're in currently?
I think one potential area is for our long haul COVID patients. About 9 out of 10 patients who are hospitalized with COVID will still report symptoms about 2 months after their hospitalization. And these patients may have permanent changes to their heart and lungs. And I can imagine using these small devices to quickly assess if they did have damage to their heart and lungs initially from their initial hospitalization. This might be able to save the patient from undergoing additional testing, such as a CT or an X-ray or an echocardiogram. Or in contrast, if you do see these findings, it promotes the doctor to actually engage in further workup and understanding of what's happening with their patient over the long term. I think with COVID, there's still so much that we are learning about this particular virus. It continues to surprise us every day. And so the applications of new technology, I think, will be super important going forward.
Definitely. Dr. Kumar, thank you for joining us and sharing a little bit more about the different ways that doctors and health programs are trying to help us get through this pandemic. I really appreciate your insight.
Thank you so much for having me.